Right, so today we want to talk about the funding outlook, demand conditions, and policy developments in Poland, Czech Republic, Hungary, and Romania. So first, starting with Poland, just two key points in terms of the Central Europe. As you may know, that healthcare sector in all the Central Europe represented by the public system. Everyone has public health insurance. If we're talking about Czech Republic, it is presented with a 7 health insurance fund. Meanwhile, other countries will have a single insurance fund. Of course, inflation and energy prices will create quite a lot of pressure on the public expenditures in all of the markets, but the countries decide to follow the different approach in this question. So starting with Poland, talking about 2023, the government decided to make some increase in the healthcare expenditures. However, that won't be enough to overcome high inflation the next year. The priority areas, which you can see from the funding distribution, will be preventative and medical device industry. Here, I should mention that part of these increases will be absorbed by the need to increase the minimum wages, which was dictated by the act on the minimum wage increase, accepted in the previous year. High hospital debts, but also the energy crisis, which would require to redistribute part of the hospital's expenditures towards utility bills, thus reducing purchasing abilities. Generally, if we're talking about the public sector, it's quite underfunded. In Poland, there's quite a lot of pressure on it. For now, we have inflation and lagging growth of the budget of the insurance fund, which creates even more pressure on the financial system. And even more pressure was created by the government introducing the amendment to the Act on the profession of doctor and dentist. The key point of the Act is the shift of the services, financial of the services from the state budget towards the National Insurance Fund. Here we're talking about finance of the highly specialized services, medicine, a couple of medicine programs. The government suggests this change is of a technical nature, aiming to optimize public expenditures. However, that could restrain access to healthcare services and exacerbate staff shortages, would create long waiting time, although it's quite long already, and that could facilitate the acceleration of the shifts of the population towards the private sector. These trends we can already see that the population is shifting towards the private sector in Poland, and but it's still at least extent than if we'll be talking about Hungary or Romania. One of the key areas is the external funding, which Denis has already mentioned. The Poland, as in other countries, rely significantly on the EU funding, specifically the Recovery and Resilience Fund. The key point here is that creates quite a lot of opportunities for the government to invest into infrastructure. However, access for the Recovery and Resilience Fund for Poland, as well as for Hungary, was frozen by the EU currently. It could be released somewhere in at the second part of this year. The Polish government will need to work more on the EU agenda. Specifically, they will need to make some progress on the judiciary system reform. But yeah, if we're talking about the medical device, the demand for medical devices, well, that will be something more in the long term and in the optimistic scenario. Another alternative funding scheme is represented by the medical fund in Poland. This fund was created just 2 years ago, and the government suggests that they will allocate 4 billion zloty each year for the medical fund. This fund creates opportunities for the government to invest into the development of the infrastructure, reimbursement of medication, specifically of innovative pharmaceuticals, support provision of highly specialized services. The key issue here is the low execution of the funding. Although the formulary of the medical fund was extended in 2022, it was 6 oncological drugs which were included and 8 drugs for rare diseases, but the low absorption rate and the low progress on the execution of the funding remains the obstacle. Moving on towards the pharmaceutical market. This trend we can see through all the Central European countries. In most of the countries, we can see the double-digit increase, which was first dictated by increase in demand. We have the after COVID return to the hospital of the population, but also the significant increase of the respiratory disease this year. and the refugee flow. Meanwhile, also we have a quite significant, quite high inflation in 2022. If we're talking about the 2023, we're still expecting some growth of the markets, but we're talking more about the single-digit increases. And again, we should take into consideration high inflation next year. The government has quite a lot of reforms. The key problem is the execution. Top three reforms and the policies which government want to pay the attention in 2023 is the Oncology Network, draft law on quality, and the modernization of the hospitals. We will be talking more about these reforms in our report in March. The key point here is a lot of delays, a lot of lack of progress from the government side. The only program which has some progress and is continuing to be implemented is the Oncology Network. And I'd like to talk more about this particular reform. The government, for the 4 years, the Polish government has the Oncology Network as a pilot in different areas of Poland. The key idea was to increase investment into the staff, into the prevention, modernization of infrastructure, and equipment of the healthcare entities. However, the pilot didn't bring positive results as it was expected. There was no reduction in inequalities in access to cancer care, no treatment guidance or effective indicators, no data confirming a reduction in the number of complications or cost in the 4 years. Does it mean that the government will stop working on this agenda? No. Yes, we're expecting some delays, but the government will continue to implement this as a pilot. And secondly, the government is planning to enter this program as a law. So where the government plans to enter in July, well, we're expecting some delays. But still, this program creates quite a lot of opportunities for global companies, and particularly working in the oncology industry. Just a quick recap, the key points of Polish market is the increased public expenditure will not be enough to overcome high inflation. Recovery and Resilience Fund is still frozen, but we can see some progress on that front somewhere in the second part of the year. And preventative care and oncology will be two key areas for Polish government, as in the most of the Central European countries. And moving on to Czech Republic. So as I mentioned, inflationary pressure and energy crisis, that's what every country would face this year. However, the approach is different. So the Czech Republic decided to prioritize healthcare sector. But let's start first with the Ministry of Health budget. So first we can see decreases in the expenditures. However, that is mainly coming from the natural reasons, stemming from the decrease of the COVID expenses. The key point with the budget for the 2023 is significant funding coming from both state level, but also from the EU, which would facilitate development of the infrastructure, increasing the quality and the coverage of the healthcare services, and implementation of the healthcare programs. Particularly, we're talking about, again, oncological programs. In terms of the external funding, Czech Republic has access to Recovery and Resilience Fund, and we're expecting strong execution of this funding this year.
Hi, my name is Krista Reganey, and I'm the Marketing Director here at FrontierView. I'd like to thank you for watching a segment of this webinar. If you'd like access to the full video and our latest insights, data, and research, sign up for a free trial with us today. Simply scan the QR code on the screen.